Now I would call Miss Laya onto the stage and Jyoti ma'am to honor. Okay. Now, since our theme is Mindscape Psychology for Next Generation, we're going to have our first very talk now. And I would like to, my favorite and most beloved Dr. Neha ma'am, I would like to call Kalyani ma'am to give an introduction about ma'am.
Namaste everyone. Welcome to our first conference of DPMP. It's my privilege and honor to introduce Dr. Neha Gala. Stress whispers doubts, but Dr. Neha Gala speaks louder. A healer of minds, she has helped many silence anxiety and reclaim peace. Today, she shares the art of stress and its management. Let's all welcome her with warmth.
So a very good morning to all of you. Thank you so much. Firstly, I'd just take 1 minute and thank the organizing team, Deccan Positive Mental Health, Dr. Dinkar sir, Sunanda madam, Jyoti madam, and Kalyani madam for this warm introduction. Thank you so much. And I am really grateful for accommodating my request. I was the second talker, but I've hijacked the first spot because of a personal emergency. So thank you for this. So see, first and before I forget, please, this is the first conference of Deccan Positive Mental Health, and I am so proud to be a part of it. I have come in touch with Deccan Positive Mental Health through my student. So it's a very big thing for me. And she's one of our best students, of course. I'm not saying this just for the sake of saying, but I see a lot of young people, and this is something that you have to approach first. Whatever I'm going to be speaking today, I want you to pass on this message, because as and when we have always been seeing that the older generation is very hesitant to talk about mental health. Whereas the younger generation is at least open to the idea of therapy, mental health. They accept it, they understand it. So you are going to be the messengers of what I am speaking to your society and your community. So I also wish Deccan Positive Mental Health and all the organizers like a heartfelt congratulations and many more wishes for the future conferences that you're going to have, and I would like to be a part of it again, please. Okay, so see, if you can see my topic, the topic is, by the way, my name is Dr. Neha, I'm an associate professor in Apollo Medical College. And yeah, psychiatry is my passion, that's why I'm a psychiatrist. My topic is not stress management, it is stress and its management. Why so? Because see, without understanding what is stress, I cannot tell you about how to manage it, right? So like Jyoti madam, when she was speaking, she has already spoken that health is not just physical health. Can you go to the next slide, please? Health is physical, mental, emotional and spiritual health. If you are not fine, like I'll give you an example, I'm not fine today, my daughter is not well, so I am not able to give my best. So even if physically I am okay right now, mentally if I'm not okay, I won't be able to give my best. I won't be able to be the best person that I am. Next slide, please. So this is just what is exactly stress? See, how many of you felt stressed before coming here today? This is a very positive group then. I felt stressed. Okay, few of you felt stressed. Can you tell me about what? Reaching on time. Yes, madam. Very good. Correct. Locate. I called Sunanda ma'am 5 times. Which building it is? Because I couldn't find it. Yes. So see, reaching on time, location, they are short-term, temporary stressor, but that is also a type of stress. So stress need not be something that is, continuously present, a huge stress. It's not. Even a daily stress that you have. Okay, coming on time, will I be reaching on time? Okay, will I be able to give nicely? Will the mic work? Did they get my PPT? Did they put up my PPT? all of these are also, even though they are minor stresses, this is stress. Okay, thank you. So, see, we are humans and our body and mind know how to keep a balance. Anything which can disturb this balance is called a stress. Simple. Anything that disturbs the balance of your body and mind is called stress. So, actual definition of stress is it's an internal state which is caused by physical demands on the body or by the environmental or social situations which are beyond our resources of coping. Please understand, this is very important because in the management this will come. It is beyond coping. See, for example, there will be some people, madam told reaching on time. There will be some people, hey, even if I reach late 5 minutes, what will happen? So they are used to that habit. Some of us are no. Time means I have to reach at least 5 minutes early. So different stress is different for all of us. And it is a body's method of reacting to a challenge. Now, why are we talking about stress? And why are we talking about this thing? What will happen if we are stressed? It's a risk factor. See, we hear of different risk factors, no? Alcohol use, substance use and everything. But this is something that all of us face, but unfortunately we are not doing much to counter it. Stress is the #1 lifestyle risk factor, along with obesity and sedentary lifestyle. See, all of us are almost having a sedentary lifestyle. You are sitting in the chairs, we are listening to lectures, or we are sitting in the chairs and giving lectures, or sitting in the chair and seeing patients. So definitely our lifestyle is very inactive. Even we are not going out to buy stuff, we are getting it delivered to our house. So all of this is adding to our risk factors, and stress is the most important risk factor that we need to deal with. Now, okay, before I go to the next slide, is all stress bad? No. Is there something called as good stress? Why is that important? Like what does that do in our life? You said yes, that's right. Correct. That makes us to move, that makes us to act. For example, because most of the students are here, if there were no exams, okay, what would you have done? Would you have studied at least? Maybe no. So some amount of stress is required for us as humans to perform or be present in our society, in the community. Okay. So see, you have something called as eustress, that is good stress, and distress, that is the bad stress. See, eustress and distress, again, please understand, it depends on individually. Like for example, I gave you an example of exams, right? So an exam for some person, it might be a very good thing. Now I will show that I am such a good student, I will do it. So it might be a eustress for somebody, but for somebody it might be a distress. There are some students who are so scared of exams that they actually cannot give their best, and they get lesser marks than what is their capability. So the difference between these two depends upon the personal experiences, personal expectations, and an individual way of coping with the stress. Please understand this. Now see, like I was telling you, eustress is important because it is short term. It helps us perform better. It is within our coping abilities. It motivates us. Most important thing is it improves our performance. It motivates us. It gives us something to look forward to, right? For example, I have come here as a speaker. So it is something that is very happy. It's a very happy thing for me. Yes, I had a bit of stress. I had to work on my PPT. I had to come. I had to find the location and come. But it is something that is motivating me, because in my journey of being a psychiatrist, this is a positive milestone for me. So this is a eustress for me. I'm not taking it as a bad stress. So if you can see the stress level, there is something called as an optimum stress level that is required for us. If there is no too little stress, like, see, we are humans, we are intelligent, we are capable. If it is too little stress, we'll be inactive, we'll not do anything, we'll not progress, we will not evolve. If our ancestors had not evolved, would we be here today? No, we would also be in cave people, no. So that's why some stress is important. But if it keeps on increasing and it is there for a long time and it is much more, it becomes too much stress and there is a risk of burnout. Now, this is a study which was done in 2022 in India. These are Indian statistics. As you can see, almost more than 20% of the population of this study, this is not the entire country's population, this is the study population, it is having stress, but it is representative of our country numbers. And as you can see, women are more stressed than men. What are the reasons that were there in this study? This was again a 2022 study, it's the same study. So maximum stress was because of the work. They are afraid of the future, there is achieving the goals, there is an issue, sleep problems, health issues, finances, family issues, all of these are there. Now, like I was discussing, stress can be acute, that is a short-term stress, and chronic. Now, this is again a little bit medical part, but this is important for us to know. Because see, you might think stress is just affecting my mental health, but no, it is affecting your physical health also. Short term may you'll feel worried, your heart is beating faster, you'll your appetite will come down, you'll not be able to sleep, and muscles are tensing up, your skin becomes a little sensitive. This is short term, but in the long term, actually I didn't want to go too much into detail, but there are different hormones, different organ systems that are affecting in short term and long term. So long term stress can cause too much damage to our bodies, which we don't realize till later. So long term it can cause tension, headaches, migraine, mental health issues, trouble breathing, heart problems, increased risk of diabetes, increased risk of hypertension, infertility issues, skin and hair problems. Okay, so these are something that a long term stress can do to your body. Now again, these are some of the myths regarding stress. All stress is bad, that we already saw that it's not so. Stress will not hurt you. Will it hurt you or will it not hurt you? It will hurt you. What stresses you also stresses me? No. Some stressors, yes, it is common to all of us. Okay, but the way or the quantity or the severity in which it affects you and me is different. Okay. For example, if I told you about the exams, there are some students who are cool. They'll not take stress. Some people will take a little bit stress. Some students are badly affected. Then no symptoms, no stress. Is that so? If you don't have any symptoms, does that mean you are not stressed? No. It does not need to have a symptom for it to come out. You should understand. That's why you should identify whether you are stressed or not. Now, can somebody give me an example of some of the stressors? Now, stressors can be external, that is the stress, that the environmental stressors around you, and internal, that is because of you as a person or your personality. So I would like somebody to give me a few examples, because I want this to be a discussion. I'm not taking a class. Yes, right. So social judgment, yes, very good. If I don't go for this function, they'll feel bad. I'm sure you must be aware. Please answer, because everybody of us face stress, no? It's small or big. Okay, one example we have already discussed is reaching on time for any event. Exams. Yes, financially, yes. Very big matter. Zero error syndrome, yes. You want to be perfect. You want to have perfectionism. What else? Comparison, yes. Very correct, sir. Peer pressure. Very good, I'm liking this. Imposter syndrome, yes. You feel that I don't deserve this, right? Academic stressors, yes. Kids, family. Yes, physical appearances, body shaming. Something very more common. See, because I'm telling you, this is when I show you the next slide, you'll be like, oh, right. What all of you said is correct. These are all stressors. But there are other stressors which are so commonly present amongst us that we don't even realize it. Noise, bright lights, too much of heat, too much of crowding. Can you work in an office where there is too much noise around you? No. Can you work if there is too much summer, like, if it's too hot? No, you can't. So these are also, that's why I was telling you, these are some of the stressors that are always present around us, and we don't even realize that it is causing us stress. It will cause you physical stress. If you are working in a hot, noisy environment the whole day, at the end of the day, are you going to feel fresh, or you're going to be like exhausted? Exhausted, right? Commuting, traveling. How many of you travel a lot till your college? So many of you. Is it easy? No, it's not, right? So commuting, workplace. Again, workplace means they'll have their own issues. My senior is not good, my co-workers are not good, my junior is not good, I don't get tea on time, I have to see lot of patients. Okay. Social, what we were talking, judgment, bullying, body shaming, aggression, social community, social commitments, major life events that you have to go through. And see, one more thing about stress that we have to understand is, we will not know if the person opposite us is having stress or not. So be kind to them, because you never know what the other person is going through, right? Lack of sleep, overloaded schedule. Like Jyoti madam was saying that since 10-15 days they are all busy with doing event, trying to organize this. So I'm sure they would have felt more stress as compared to usual. Internal personality, your own personality. See, there is a concept called as type A, type B personality. It's not exactly watertight, but type A personalities are again perfectionist. They worry too much, so they take stress also too much. Okay. Negative self-talk, criticism, criticizing yourself, feeling very pessimistic. It will not go good. My exam is not going to go well. How much ever I study, I'm not going to perform well. Unrealistic expectations that you have of yourself, your family has of you. Okay. Guilt, taking things too personally. All of these, and again, anything can be a stress. It can go on and on and on and on. In fact, I haven't put it up because it was becoming too much, but there is something called as life event scale. Any life event has a rating in that scale. Okay, if you want, I will share it with you later on. So each life event has a what do you call, a ranking. The more the life events that has happened to you, the more will be that ranking. So for example, in that scale, death of a spouse is considered to be the maximum stressful event. So it's got 100 ranking. So it's got the maximum stress. Anything, changing a job, marriage, divorce, getting a promotion, and getting into a new relationship, having a child, all of these are life events which have their own ranking. So if you're interested, you can just check it, or I'll share it with ma'am later on. Now, I'm just taking a minute to tell you this. How does your body respond to stress? See, I'm taking a lot of time to tell you this because if you don't understand this, there's no point in understanding about the management of stress. See, initially what happens? How does your body react to stress? So initially you have something called as alarm reaction. Your sympathetic nervous system works. So you will immediately, you become alert. Supposingly your man comes and tells you, okay, that tomorrow you're going to have a test. So immediately your body's sympathetic nervous system increases, your heart rate increases, your mind becomes more alert. Your body decides that, okay, something I have to do, so I'll be more alert and more active. So your body starts working on that. But what happens to us once the stress keeps on increasing or keeps on continuing? Stage of resistance happens in the middle part. That time what happens, if there is a stress which is there from a long time, like a chronic stress, your body just resists to it. So, you are not able to fight it much, or either your body will fight too much with it. So your immunity becomes low. You will start having a lot of these anxieties. You'll have a lot of sleep problems, appetite problems. The problem comes in this last part, stage of exhaustion. See, at least in the alarm stage or in the resistance stage, your body is fighting with the stress. Unfortunately, if it goes in the stage of exhaustion, your body has now depleted all its resources to fight the stress. So now you have no more coping mechanisms to fight with the stress. So your mind is not going to function. You'll have physical illnesses, especially cortisol, which is a stress hormone. Here it becomes very active. Chronic chronic stress can lead to complete depletion of your body's resources. So your immunity will be completely low. You'll get a lot of physical and mental illnesses. So that is why you need to try and stop the stress as soon as possible. See, again, I'm sure you all know, but can you tell me what are some of the symptoms that can happen if you are stressed? Headaches, yes, very first thing. Sweating, migraines, palpitations, panic, giddiness, appetite changes, shivering, yes, sweating, yes, body pains, lack of sleep. What will happen to your mental capacity? Low. What will happen to your concentration? Irritated. You'll be irritated. So behaviorally, how you will be irritated. So if you can see these are the physical symptoms. So like you said, aches and pains, fatigue, gastric problems, constipation, indigestion, nausea, dizziness, chest pain, colds, breathlessness, sweating. Okay. So every system can get affected. It's not going to be just one or two. Every system can get affected. Emotional symptoms, moodiness, tearfulness. Emotionally you'll be very labile, agitated, you'll feel overwhelmed, you'll feel isolated, you'll feel emotional, you'll feel lonely, and sadness. You'll not be able to enjoy anything. Cognitive, that is, how is your mind working? So your memory problems, inability to concentrate, you'll not be able to make good decisions or good judgments. Pessimistic approach, constant worrying will be there. Behaviorally, you'll sleep too much or too little, you'll not talk to people properly, you'll isolate yourself. Some people go into the negative way, they start abusing drugs or alcohol or smoking to cope with these things. Fidgeting, procrastination, absenteeism, you'll not go and perform at your workplace or at your college. These are now the stress. See, these were the symptoms. These are the illnesses. Any of these illnesses can have stress as the main factor. Cardiovascular disease, immunity problems, asthma, diabetes, ulcers. See, lot of patients come to us with, not more, they get referred to us from gastrointestinal doctors, but ulcers, stomach ulcers, intestinal ulcers. Stress is one of the major risk factors for that. And they don't even realize it till later that it's because of stress that it is happening. They think, oh, it is because of some food that I ate or something. Skin disorder, headaches, migraines, premenstrual disorder in females. And psychiatric disorders, so definitely it will be there. Depression, anxiety, substance abuse, because people get addicted to other drugs to cope up with this. Anxiety disorders, panic disorders. Okay. Now, how do you manage stress? Before I tell you, why don't you tell me what are some of the things that you people do, some of you do when you feel very stressed? Meditation, yes. Breathing exercises. Sir does jumping, yes. That is also something that you enjoy, that's great. Madam? Video games, madam plays video games, yes. That can also be a break and you can do that. Singing, music, watching TV, yes. So see, if you can see what all your answers are, everybody has their own way to deal with the stress. Before we start the stress management, please remember what all I have told you about stress. Because see, managing you can only do when you know that you are stressed. Or when you know that somebody, your loved one is stressed, you can help them out. And yes, please, if you feel that it is something which is not, improving with smaller things that you can do at home, or you can do like singing or music or dancing or anything, you have to consult a specialist. Please understand that. So, stress management, yes, just as everybody's stress is different, everybody's way of managing stress is also different. See, I'll give you an example. Sometimes I'm a psychiatrist, so sometimes when I see a lot of patients at once, I get affected because physically I don't have to do much, but mentally listening to their problems or listening to their conditions for 1 hour, 2 hours continuously, I get a little bit tired. So before I see the next patient, I tell my students, tell them to wait for 2 minutes. In those 2 minutes, I'll either, I'll watch some small song or some scene in my phone, something, they'll just, that constant thing will not be there. So that 2 minutes break also helps me a lot. So before I go on to the next patient, I don't carry the first patient's burden with me when I go to the second patient. So even those 2 minutes of break is helpful. Okay. So that's when we tell students also, when they are studying also, sometimes you don't have to sit 7 hours or 5 hours continuously. Study for 20 to 30 minutes, take a break of 5 minutes. But then break should only be 5 minutes. It shouldn't extend. I'll see one scene karke, it shouldn't go on to one entire episode. Okay. Social media, no. So in one entire episode you'll see off. Don't do that. Take a break of again 20 minutes, like study again for 20 to 30 minutes, again take a break of 5 minutes. Those breaks are important because our mind cannot concentrate for more than 20 to 30 minutes. Okay. So stress management. Why should you do stress management? Because obviously your stress will come down, common sense. Improved sleep, decrease stress related symptoms. You'll be having a better self-esteem. You'll feel in control of your life. Sometimes, all of us feel that I'm not in control of my own life. I'm not able to manage anything. And you become very negative. All those negative thoughts will start coming. Decreased use of medications, improved relaxation will happen once you do stress management. See, also please understand, most of the stress that we have now is self-generated. Certain things you have to let go. For each of you, it might be different. Certain things are in our hands, but certain things are not in our hands. Somebody said that time, social judgment, reaching on time. At least reaching on time is in your hand. You have to start on time. You have to come, give some gap that you should be able to come early. You should do that. Right? But how others are thinking of me, that is not in my hands. So I don't need to take stress about it. Try to understand that. So see, when you are doing wellness, so you have two things. One is a problem focused strategy that you can do. Second you can do is emotion focused strategy. If, simply put, if it is a problem which you can deal with, focus on dealing with the problem. But if it is something that you cannot deal with, if you have, say, a senior or a relative, a senior at workplace or a relative who is not, they are not, I would say they are a troublesome person and they are troubling you, you cannot change them. So in that case, what you can do, regulate your own emotions of how to deal with it. Don't take it personally. Keep minimum contact with them. Something like that you can do. So if you just identify your stress and see which of these you can work on it. Of course, see, this is just an example that I'm giving you. Sometimes, it's not just black and white. Stress, hey, I'll work on it, my stress will go away. No, it will be an ongoing process in your life. Sometimes you might need help from somebody else, maybe your friends, your loved ones, sometimes from a professional, a psychologist or a psychiatrist. In that case, don't hesitate to come forward and ask for help. Like ma'am said, no, ki when you have a physical pain, you'll immediately go to a doctor. But when you have mental health issues, or when you are not even, you don't even have to need to have a disorder. When you are not feeling fine, why can't you ask for help? What is the shame in asking for help? If it is a fracture, will you tell that person, nothing will happen, let's go have tea, nothing will happen? You'll tell that person? No. But when a person comes to you and tells you, yaar, I'm feeling very stressed, I'm feeling very sad, something is happening, what will be our response? Chalo, let's go have tea, let's go have coffee, let's go watch a movie, we'll be fine. It doesn't work that way. You need to give them a sympathetic ear, but do not belittle their problems. Then you can also try this ABC strategies. Awareness. What is my stress? Balance. Try to balance. If you are not able to take out the stressor, just try to control your emotions or your dealing with it. You have to change your thinking, you have to change your behavior, and you have to change your lifestyle. Only then you will be able to change your stress. So thinking is, learn to say no sometimes. Like madam was saying, social commitments. Every time everybody invites, I have to go. Why? Sometimes you learn to say no. Change the way you think. Behavior. Try to be versatile, try to be assertive. Laugh out loud. Lifestyle. Of course, lifestyle, healthy eating, healthy lifestyle, it's easier said than done, but still try. So again, these are some of the things that you people have already told me. I'll just name them because we are running short of time. Medication, sometimes yes. Sometimes the stress becomes too much and you need to take medications. And because I'm a doctor and I'm a psychiatrist, for me, if I find that a patient is having stress which is leading to some psychiatric illness, I will always advise them medications because I don't want my patients to suffer unnecessarily. If you have pain, you'll take a paracetamol, no? You'll take a painkiller, no? So why don't you take medications when you have a mental problem? You can. Medications, counseling, psychotherapy, this will be your domain because that is the psychologist domain. Relaxation, sometimes hypnosis, biofeedback, desensitization, these are all psychological terms. Meditation, yoga, which you people have already told me. Sometimes creative visualization. Sometimes just sit and daydream. Close your eyes and think that, you know, supposingly I have to give a talk today. So I'll just close my eyes and think my talk has gone well. Everybody is liking my talk. I am happy at the end of my talk. So sometimes if you just use your imagination to paint a good positive picture, that will help you. Cognitive responses, that is change the way you think. Physical exercise, laughter, aromatherapy. Some people like to go to the spa or massages, or even simply putting aromatherapy, simply putting one nice candle or agarbatti will also improve your mood because smells have a direct relation to our emotions. Stress ball, prayer, gratitude, reading, or any hobby that you have. Very, 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 very important is a support system. Whether it is your family, whether it is your friends, whether it is your co-workers. See, I'll give you an example. Your co-workers know the best how you are dealing, right? If you have a bad boss, you and your co-worker both are affected. So talk to each other. You know, you'll be fine. वो जो हम लोग दिल में बोलते हैं ना कि भड़ास निकाल दी एक दूसरे से बात करके, do that. You'll feel fine. Music. Sometimes do nothing. Sometimes just be like, okay, I'm taking this 1 hour, I don't want to do anything. Just don't do anything. Whatever is there. Time, आराम करो, बैठो. Just like don't plan कि हाँ, in this 1 hour I have to do this. No. Just take where your mind goes, where your body goes. That's it. Time management. These are some of the things that you can do. Again, this is just a... Yes. Sir, I'll give you an example. Sir, when we go for vacation, do you sometimes take your phone with you? Sometimes when you are on vacation, you don't even realize where is my phone. But when you are actively doing, all the time your phone will be on hand. My boss will call, my junior will call, this will call, that will call. Why? Sometimes give yourself a cell phone break also. Cell phone holiday, yes. Very important. We are so... See, it is like that, you know. I read somewhere and I really think it's true. It's like a fridge. You'll open the fridge and see is there anything to it. So you'll open your message. Something is there. Instagram, something is there. Even if there is nothing, if you see that message after 15 minutes, what will happen? No, you want to see it now only. You want to reply to it now only. Why? You can reply to it after 5 minutes, no? If it is urgent, they'll call you. So keep your phone sometimes, you know, away. Yes, that is again, that danger part is of course there, right? You shouldn't use the phone in the kitchen. What sir is saying is right. Most commonly, you taking the phone with you in the bathroom. It has become a habit for everybody almost, right? Even if you take out for some work, you'll do the work and you'll keep down? No. You'll take it, do that work, then that whole cycle will start. Facebook, Instagram, YouTube, something. Okay. So these are again the same thing. It's just a diagrammatic representation. See, meditation, what you have already told me, I'll not tell you, but a lot of times, you know, people feel that meditation means I should not get any thoughts. I should focus. It's not necessary. Some people cannot do that, you know, some people cannot do a complete proper meditation where they don't have any thoughts. So in that case, what you can do, you can have a focus, like take a candle or a flower in front of you and just look at it. That's it. Or you can keep chanting some mantras, whatever mantras or, prayer or anything that you are comfortable with. Or if you're not able to do that also, just do deep breathing and focus on your breathing. That's it. You don't even have to do something more than that. Okay, so you have multiple ways in which you can manage stress. But And see, out of all of these things, are these difficult? Are they time taking? No, they are not difficult. They are not time taking. You can do it sitting now. You can do it sitting in your class. You can do it when you are going in your commuting, when you are in your bus or cab. You can do it when you are sitting at home also. It doesn't require time. It doesn't require any special materials. It doesn't require money. Okay, it doesn't require special time also. So when you are giving so much time to your stress, please give some time to the management also. Okay. See, again, meditation, it will help you with pain relief, stress management, anger management. It helps you control your anxiety. That feeling of, always being on the edge. Always you are like, okay, what will happen? Something will happen, something will happen, something. That will calm down. Okay. And this is one of my favorite movies, and this is one of my favorite sentences from that. That your mind is like this water. Can you see in a running water or agitated water? You cannot. It's like that. But if you allow it to settle, the answer becomes clear. Okay. So I hope I have been of some help in talking to you about the stress and stress management. If at all you have any questions or anything, you can, of course, everybody else is there. You can take my contact details from Sunanda madam if you would like to. I might not stay back till the end of the conference. I apologize for that. I'm extremely sorry for this. But you can take my details from madam, and you can mail me or you can message me. So thank you so much for this opportunity. Thank you.
Thank you, Dr. Neha ma'am, for always inspiring us here and in college. You're my inspiration. I would call Ms. Sunanda and Ms. Kalyani and Dr. Suresh sir to honor ma'am. Now we